Good evening to all the viewers who are watching live and will be watching in a recorded version since it's the time for Qatar World Cup, FIFA World Cup. So that's why we are keeping this seminar in a short form. So without wasting any more time, let's just jump into our session with the 30 seconds countdown time.
Good evening, everybody, and happy winter. Good evening,
Good
sir.
evening. Very good evening.
And after a grand ninth alumni meet, we are back again on the 61st CME tonight, and we have a very important topic. But before that, to inaugurate this session with permission of Kalyani sir, uh, I'd like to request our inaugurator tonight, that young dynamic lady from 22nd batch, uh, Dr. Pandey, to inaugurate tonight's session. Sir, with your permission, please.
Yes, sir. No, definitely. Please start.
Dr. Kaveri Pandey, she is from 22nd batch, the young and dynamic uh, doctor now pursuing her professional life. Over to you, Dr. Kaveri.
Thank you, sir. Thank you so much. I would like to thank Dr. Bidyut Mukherjee, sir, and Dr. Kalyani, sir, for having me here today as an inaugurator for today's CME. It's really a great pleasure and honor to be a part of CME. I would also like to say a very warm good evening to all our viewers. I'm Dr. Kaveri Pandey from 22nd batch of NIH. I've also done my post-graduation in hospital management from National Institute of Public Health Training and Research, and I'm really blessed to be a part of both these institutes. I would also like to congratulate NIH Alumni Association for their long journey from their first CME to till now. So a very congratulations to everyone. Now, without wasting any further time, I would like to take our attention to our today's topic, that is cancer clinical trial, treatment management, and the ongoing research in NIH. For taking our discussion today, we have as our speaker, our honorable speaker, Dr. Pijush Kumar Mishra, sir. So let me just give a brief intro about sir. Dr. Pijush Kumar Mishra is a well-known academician and clinician. He is from the second batch of Deep NIH. He was the former research officer and HOD of research at NIH. With his keen interest in research, he carried out many research work at NIH. To name a few, HIV and AIDS, research on cataract, research on cancer, and thyroid research. He was also a WHO doctoral research fellow on the project HIV and AIDS. I would like to also introduce our special moderator today, Dr. B.N. Prakash sir. Dr. B.N. Prakash sir is a well-known and versatile personality in homeopathic fraternity. He was the former director of Department of AYUSH under Karnataka government, and he was also a former member of Central Council of Homeopathy. He has lectured at Father Muller Homeopathic College. He has also served as a principal of Government Homeopathic Medical College, Bangalore. He is a leading practitioner. He has presented many papers at national seminars. It's a great honor to have him here with us today as a moderator to help us carry forward the discussion. I welcome both of you, sir. Please welcome. Now I would like to hand over the mic to Dr. B.N. Prakash, sir.
Very nice to see a young and energetic and active professional product of the National Institute of Homeopathy. As always, we are very proud of you as an alumni, and I am sure that you will live up to the expectations of NIH product. And now coming to the subject, anyway, I also very happy to be with Dr. Pijush Kumar Sharma, who was just an year ahead of me in National Institute of Homeopathy. He was the second batch of deep NIH and the third batch of deep NIH. So we know each other very well about 40 years back during our life in NIH at Amer Street. Now coming to the subject, I feel that cancer is an outcome of cancerous process. We should be more, as a homeopath, we should be focused both on the cancer as an end product or as a product of cancerous process. Cancerous process begins much earlier than the cancer itself. So cancer is the cancerous process, I feel, is an expression of syphilitic miasm. So the cancerous process begins in a very slow, steady, insidious manner. The actual beginning of the cancerous process cannot be traced. We can only know through the changes of the mind, the character of the person, the behavior of the person, the so-called the syphilitic expressions of the mind and body. And that gradually the cancerous process develops and the cancer begins. Once the cancer begins, we develop the signs and symptoms of cancer. Now, when it is better to treat the patient constitutionally or give anti-miasmatic medicine when we are lucky to find the cancerous process and treat it for a curative purposes. But once the cancer process begins, I think our focus is based on palliation, giving a palliative care. But most of the patients who come to us with cancer, we are able to provide only palliative care, and curative care is very difficult. Only those who are very lucky, we can able to do some curative relief. But palliative care is our focus when the patient is in cancer condition. Cancer process, of course, we can treat it in a constitutional manner, in an anti-miasmatic manner, and there we have better chances of curing the patient and reducing the speed of the development of cancerous process and reducing, if possible, can also reverse the cancerous process. However, it will take a lot of time. There are a lot of ifs and buts. And so I wish to see what actually has happened in NIH and what our speaker has done in the National Institute of Homeopathy during his tenure there. So I welcome Dr. Sharma to present his talk. Hello. Hello.
Dr. Mishra.
Hello.
Dr.
Yeah.
Pijush Mishra. Mishra, not Sharma. Yeah.
Hello.
So, thank you all. Sir, would you like to speak more? Hello? Hello? Hello?
You start, sir. Please
Yes,
continue,
sir.
sir.
Yeah.
Thank you,
So,
sir.
good evening to you all. To Dr. Bidyut Mukherjee, General Secretary of our Alumni, and Dr. D.N. Kalyani, former HOD Research, and our inaugurator, Dr. Kaveri Pandey, and very distinguished person, the moderator. He was a director of two institutes. One is one AYUSH in Karnataka, and another is Rajiv Gandhi Health Institutes, Health Science. So he was holding the two directorship post, and very distinguished person. He has given some brief about cancer. This is National Institute in Homeopathy, where from he passed, where from he had passed, where from I have passed, and where from Dr. D.N. Kalyani had passed, and Dr. Kaveri Pandey also this was a student of National Institute of Homeopathy. So first, I like to uh, say there are two directors I have seen in my homeopathic life. One is Dr. K.P. Majumdar, whose student I was, and another is recently Dr. Ishar Das. Tremendous development of this National Institute of Homeopathy was done by Dr. K.P. Majumdar in the past, and now by Dr. Ishar Das. You see a very good building, auditorium, all every good things of this in the light of modern civilization. We must appreciate Dr. Ishar Das. And he happened to be my senior, the first batch. Now, I am talking about Dr. Das specially because he had inaugurated this cancer program in NIH. The then Health Minister, Dr. Ram Das, he asked the governing body to do some research on gross pathological changes at NIH. And Dr. Ishar Das took this as a challenge. And he launched this program. And I was the principal investigator during his time. So it happened that very interestingly, that that time, Dr. Sanjay Das, oncologist, he joined with me. Sanjay Das. Now still he is teaching boys in NIH, surgery. And also he's attached to cancer research. Dr. Das, on the day of inauguration, was displeased. He asked me, Dr. Mishra, you don't have chemotherapy, you don't have radiotherapy, you don't have anti-cancer drug where you are going to launch cancer research. So fatal disease. Anything bad will happen. Then as a learned physician, I shall be the responsible factor for that. I told, sir, all the cases truly diagnosed as cancer, I shall refer it to you. And all those cases not diagnosed as cancer, but clinically evident that it is a case of cancer, so those are the cases I would take up, and I would give them medicine. We started like this, and after 3 months, Dr. Sanjay Das told me, Dr. Mishra, you and me both together will treat a cancer patient with my remedy and your remedy, because I have seen the cases where you are not prescribing the homeopathy medicine, why I am alone prescribing the chemotherapy, radiotherapy like drugs, the outcome is not good. But I have seen at the same time, what are the cases you are seeing here? Their lifespan is better, their outcome is better, they live longer. And in my case, the people died. So I request you, the both of us jointly will take this matter. So I was just smiling because Dr. Das, unknowingly, what I was intending to do in a practice, in a clinical research, you need a control media. If you want to do some clinical trials, you need a control media, maybe placebo, and in dangerous cases, not placebo, but some conventional drugs, but some drugs, ethical issue, unethical issue. So what I did, those cases given to Dr. Sanjay Das was a mean for control trials. And the outcome, we got it from Dr. Sanjay Das. The outcome was not good. The other important thing is, people, those are coming to National Institute of Homeopathy or any government hospital, they were nearly bankrupted by the private organizations. They took lump sum money, give very high promise, and lastly told, you take your man to your home, give him good diet, he will die one day. We do not like to keep him here. He also no need to keep you here. Those are the cases, totally being bankrupted and devastated condition. They rush to government hospital. So we are getting in our cancer clinical trials, majority of the cases of terminal malignancy. That Dr. B.N. Prakash was just stating that when you are getting patients, a well-established case, devastating cases, terminal malignancy cases, what we best can do. That is a very important point. It's a very important point. Now, if you go with the old literatures, starting from Kent to all stalwarts, I was surprised to see that they are mentioning the cancer patients they underwent his treatment, but they could not give them life. All of them passed away. So what our director, former director, was just telling, Dr. Moderator, Dr. B.N. Prakash, absolutely true. Absolutely true. You cannot wish for cure. You cannot even wish for giving him maximum relief. You can at least give him some palliation. It actually not only is related to homeopathy, also to allopathy. I got two patients. One patient, some name Onska, a young girl of say 7-8 years, mild leukemia. He was undergoing treatment in the Tata Cancer Hospital. The blast is nearly 70%. They gave her chemotherapy, and lastly told, we could not prescribe any chemotherapy, but now this organ will be injured. You take it to any hospital, any other hospital, any non-allopathic hospital, non-conventional hospital. Then they brought that patient to us. That time Dr. Sanjay Das also was present. Wonderfully, when I prescribe medicine, homeopathic medicine, after 15 days, when I did the blood report, CBC report, to our surprise, the report was completely normal. No blast cell, nothing else. He was having nearly 80,000 count and about 40%, 30% blast cell. So I thought of Dr. Sanjay Das told, maybe it's a mistake. Someone's blood report has been sent to us. Do it, repeat it, Dr. Mishra, again. I did it. The same result yielded. The report went to Tropical Schools of Medicine. Tropical Schools of Medicine head, he talked with me over telephone. See, she told me, Dr. Mishra, what medicine you have prescribed, everything is all right, the whole picture is all right. What medicine you have prescribed? Which you have homeopathic medicines. There are a lot of medicines, not one medicine. Then she told that it's unbelievable. It's unbelievable. You are doing something you are not telling us, confessing us. Maybe some secret medicine, maybe some magic medicine. We have heard there are some magicians also in the name of physician. So you are not saying that truth. That patient survived here 2013 like that, not 2013. So prior to that, and she was under my treatment. Her father was an engineer. and her mother left service to give care to her daughter. So this thing went on, and she required some time, some supplications, and required blood donation. So I asked his father, he is the same, having the same group. You give it to your daughter. Don't purchase it from outside. But his father was a noble, needle phobia. Anyway, she was admitted in another hospital. They gave her one bag of Paxil and other things, allopathically, what are the things required. And that girl expired due to transfusion failure. Another one is a meningioma of brain. My colleague, Dr. Samanto, Dr. Kalyani, HOD research formerly, he knows him well. We are the colleagues. He brought his one brother's colleague. His one eye was protruding out, red, bursting and protruding out. People would be afraid of seeing him. Then he told Dr. Mishra, you are doing this work, do it. I don't expect anything good, but you do it. They are completely avoiding to treat him. It's all right. His name was Shankar Haldar, but 50 years of old. We started treatment. Surprisingly, that protruding eye sets in normal position. And one could not imagine that these two eyes are different. Completely normal. How it is possible? Still I am wondering. And he told everyone, every doctor told me you will die after 6 months. See, I am already passing 3 years. I'm still surviving. That patient, I'm just seeing here, came to us. So year 2013, 2012, 2011 or 12, and got my treatment up to 2015. So yeah, nearly 3 years above passed. Then I was retired. After our retirement, with the request of the all, I was sitting there nearby one dispensary, and Mr. Shankar Haldar used to come to me, and I used to give him medicine. Dr. Das used to check him, but suddenly it took a U-turn, and he had a lot of problems. We could not do much. Possibly he died, and their family did not report it to me. So nearly, I'm not telling. See, there is a point is law of probability. If I see 10,000 cases, and if I get a 2 patient got cured, that's not the statistics. But in this scenario, I'm just telling you, even I cannot explain, but how this thing happens. So there are many cancer cases which did not succumb. Say, for example, lymphocytic leukemia, chronic. I know my one doctor of PG hospital once told me, the old lady is still coming to PG and asked the all doctors, hey bhai, beta, বাবা আমার হাতটা একটু ব্লাডটা করে দিতে একটু দেখ তো কি অবস্থায় আছি chronic lymphocytic leukemia life expectancy may not be affected. She or he may enjoy the normal life expectancy. So you see the colorectal cancer. Colorectal cancer also life expectancy is high. But when the question of coming for esophagus or for stomach, for thyroid, for vital organ, when the vital organ are affected, the outcome is grave. Now, it's quite understandable that why you have called Dr. Mishra to say on cancer. to say that we are not able to do anything for cancer. For that, you have lost, you are killing your valuable time to listen that cancer is incurable. Cancer cannot be controlled. Cancer is only palliable. But from my long experience of seeing 1,200 cases, all after coming back to my home, also in the home, some small dispensary, seeing some, say, 70, 40, 50, 70 cases, but the outcome is not positive. I'm truly, honestly telling you, the outcome is not positive. Why not? I'm asking everyone. Sometimes also I asked to Dr. Kalyani also. For arsenic ulcer, you are giving arsenic wonderfully active. But when cancer is there, the same arsenic is not acting. This happens to homeopathy. When you're all these well-proved remedies, nicely acting on almost all diseases, except some incurable diseases, they are not working at all in homeopathy. But they are giving palliation. I do agree with you. Because I have given maximum relief to cancer patients through palliation. So one time I was broken down. I saw a lot of cases, children, sister, wife, mother, all died one after one in National Institute of Homeopathy. I used to admit them. Before joining that program, all doctors are usually referring those cases to other hospitals. I asked them, don't refer any case to other hospitals. The outcome will be much, much better or worse. Rather you stick to this. Go with the homeopathy medicine. See what we are able to do. When the pain in something is non-tolerable, we are advocating for, we prescribe allopathy medicine. Let the pain subside. Then we again start homeopathy medicine. But this is very important that when I was nearly broken down, Dr. Sanjay Das told me, I told Dr. Sanjay Das, sir, I should leave this cancer program. So this is hell. I cannot tolerate, sir. I cannot go to sleep. So I could remember one young chap, one doctor, very handsome doctor, of Calcutta Medical College. At that time, my college was a must-eat. Dr. B.N. Prakash knows. We used to go to Calcutta Medical College, one restaurant for taking some snacks, food. I used to see a very handsome young boy, young chap, was sitting on a chair, and we went on taking teas and cigarettes. That time cigarette was allowed inside the restaurant. Out of curiosity, I asked the boy, who is this very beautiful look, handsome boy? Why he's always taking sips of teas, then coffees, then chain smoking? He says, sir, he's a doctor. He's working in the Calcutta Medical College. He's dealing the cancer cases. He has told me, sir, ask, how long I shall go on telling lie to those victims that you will be all right? I'm seeing that one day after day, one bed is being emptied, was taken to graveyard. But I'm going on saying this to everyone that you will be recovered. Don't worry, you will be recovered. This scenario still remains. In the name of development, cancer treatment, chemotherapy, radiotherapy, targeted drugs, hormonotherapy, and other drugs, the scenario is same. And the very interesting thing is, initially, their chemotherapy, radiotherapy worked wonderfully. You spend almost all same 7-8 lakhs rupees in Tata Cancer in other areas. You got back your beloved one, your daughter, your wife, your son, your brother. Everybody happy. Oh, he's all right. He has come back. He's doing his service. But after say 1 year, after say 2 years, when the same thing came, when he was further taken to that hospital, that chemotherapy, the radiotherapy did not work at all. Then they said, no, it won't work. It won't work. That is one of the reasons that homeopathy doctors are why getting cancer patients. Had they got their treatment properly, they would have not come to us. They were driven out of their hospital. So they have come to us. Now, in our scenario, the same U-turn is also there. When you will see some cases, I'm seeing out of 1,200 cases I've seen, that some cases which are responding nice, well, like Shankar Haldar, they refuse to accept medicine further. That's hopeless. That is totally immune suppression. Maybe the immune was initially accelerating, and the cancer against this medicinal action, he got strengthened himself manyfold, and then medicine has no role. So now this is the very vital question. I'm not going to taking a class on oncology. I'm going to speak on homeopathy. So my jurisdiction should be in homeopathy and cancer, not oncology. 90% cover. People are usually covering 95% in allopathic subject and only saying 5% in homeopathic subject, which is disgusting. So it always giving me pain, always thinking me pain. I'm telling, even I told Dr. Kalyani also, Dr. Kalyani, it is always I'm thinking, what we are leaving behind for the next generation? What light, what hope we are able to give to the next generation? Then after my departure, they will do some better. Then in the longer period, my grandson will not be affected of cancer. Then we could have told like smallpox eradicated, the cancer is being eradicated. We are not able to say. So fortunately, you see the HIV and AIDS who came much later than cancer, but they were sufficient to establish the virus, HIV virus. Now they have the antiretroviral treatment. By antiretroviral treatment, those are the embryos, those are the inside the womb fetus are affected to HIV and AIDS, they are got freed. That is one of the achievements they have done. So that one of the great achievement. But in cancer, one after one, door is being closed. Cancer door is being closed. Possibly, Dr. Kennedy, President of the United States, he arranged everything for launching rocket in moon and succeeded in doing that. That's why Dr. Nixon, President Nixon, told man can conquer moon, man cannot conquer cancer. So multicentric study centers build up throughout whole world. A flow of billions and billions of dollars rush to them. But out of that, after 50 years, the 40 years, the outcome is not inspiring. Rather, one of the door by door, the door is being closed. And the money is flown to for HIV and AIDS, malaria, for other. Now WHO is not very interested to give at cancer fund because the outcome is not promising. So this is one of the very important point that I'm telling that what is our position now, what we shall do now. This is very important position. This we must be very serious. We must be very much thinking this. So we shall do that. We are for example, like me example, Dr. Kalyani also could give some example. Dr. Pandey also could give some example. Dr. B.N. Prakash also can give some example that in his case, 2 cases, he saw the cure of cancer, the relief of cancer. But in the rule of probability, where the thousands and thousands of cases, the only showing 1 or 2 or 3 cases by chance is not as valid. But for your confidence, I've told, that during my cancer cases, 1,200 more cases, for spying that cancer is doing something on certain individual. We could not explain how the blood cell disappeared, how the blood picture became same. We cannot ascertain. So now this is a great point. That is a great point. How then homeopathy is to be, medicine is to be built up with the same style as you are doing that, proving, reproving, and clinical verifications. In cancer, clinical verification not possible. Proving and reproving. So is it the same way we will be following, or will change the way? This is a very important question. So why the arsenic working on cancer ulcer? Why the arsenic is not working on cancer? So whether we'll reset our motion of developing the drug therapy. If you go with our Upanishad, our Ayurveda, and others, you find there is addition with many drugs. They added sulfur with mercury, like they added copper with sulfur with mercury. So this has inspired me. With the old literatures, if you see such mixtures that they are producing in their Ayurvedic system some 1,000 years before, we could have taken that. We could have prepared a separate book on cancer. When a new disease comes, a new drug comes, and a new book evolves. Cancer is not a new disease, oldest disease. In the human history, if you go to the medicine, you see the oldest disease is malaria. Oldest disease is leprosy. And the oldest one is tuberculosis. These are the oldest disease in our medicine book. And recently I was reading a very fantastic book. Where it is written, as you see in our says, there is a species, genus, like classifications. What is always I'm thinking that whether this HIV/AIDS is not this is subgenus, subspecies classification. Maybe it's one, but with the time, with the evolution, it is changing its shape. Maybe smallpox is not there, but smallpox has been transformed to some other new entity, which we could not understand. Maybe this COVID-19, maybe a new transformation of the old smallpox. That was a DNA, and here it was mRNA. The difference is this. So that's why when I presented a paper to WHO recently on COVID-19, I greatly emphasized that why don't you start these smallpox vaccinations. Cowpox vaccination is a less harmful. Cowpox vaccination effect everyone knows. And the cowpox is not bringing death. So why don't you take a pilot program to give them the smallpox, the cowpox vaccine, and you see how they react with the COVID-19. You may do it also in a lab. I do not know whether they are doing something as per my hypothesis or they are discarding this. But my idea is there is not many folds. It is only you see differently. The same water is in the ocean. Same water is in the river. Same water is in a pond. Same water is in a well. But we see it differently. So when there is tsunami, you would be surprised. I was surprised seeing that my well, there is a great epicenter slide. Why the tsunami happened and how how the water came to my well here. So how they are interrelated. Everything is related to everything. This is the basic philosophy of this living entity, this universe. Now, what I mean to say that, so some of the article points I just pointed out so that I shall not forget that. I shall give you to now. These drug discoveries, understand that. You also understand that this is a great chapter of mechanisms and dynamics. If we do not understand dynamics properly, simply discarding, oh, dynamics, that is not within the domain of physical, chemical, all these things. Oh, that's in the book, let it in the book. Let us pass in that exam. We're saying something about dynamics. What is dynamics? That's important. It is not electrical, it is not physical, it is not chemical. Then what it is? See, moon moves around the earth. Earth moves around the sun. It is dynamics. The force by that it runs is dynamics. So moon with the dynamics moves around the earth and sun. So you see there are flowers, there are seeds, there are waters, there are life. So this is dynamics. The crude example is if you take some iron particles, you take a magnet, you make a magnet, then you bring the magnet nearer to iron particles. The iron particles will be drawn by the magnet. It is the electrodynamic phenomenon. It is electrodynamic phenomenon. There is two things. Whole universe is, one is mass, another is motion. Mass and motion. By mass and motion, mathematically, you can calculate the entire universe. The great scientist that time, great philosopher, he narrated this, the mass and motion. Now you see in Einstein, E is equal to mc square. The same mass, same velocity, everything. When you see a metal, there is proton, there is electron, so there is motion and there is mass. So it is inseparable. So here also, that is very interesting part of this scientific philosophical thought is this very interesting part. In relation to cancer, I'm telling, not I'm going out of the track. This is also relation to cancer. How we shall design our next proving or the next remedies for cancer. So this mass and motion, when you are preparing a homeopathy medicine, take from iron, you are taking 1 grain of iron and you are mixing with 99 parts. And go on, dilution, reaching to CM. This is very interesting. That part, homeopathy, the Western philosophers cannot explain. Our Indian philosophers, the Upanishad, the Veda, Vedanta, they are much developed. They could not reach to them even. They have told here that from the entire entity, you will see three things. One is the essence, that is the intelligence. One is the force, the energy, that is driving. And one is inertia, that is mass. Naturally, these things are in equilibrium state. When you can bring the non-equilibrium state, then you get something new. That is called evolution or that is called creation. The people are telling evolution. I don't understand that. I understand creation. This is creation. This is reality. These are the three things are the realities. The real is consisting of these three things. We call this guna, the quantity, quality. Now, if you make them, this agreement, you make them in a stage of in equilibrium, then there is a preponderance of one to another. And there is something new will come up. So long the things are in equilibrium state, you cannot bring some new thing there. That animal idea, same animal idea. So there is alternation of your state of health, either in the form of disease or in the form of medicinal disease, natural disease or medicinal disease. You must have to have this alternation state of. Then only you are able to make a man sick. Then you are able to make a man getting cured. So that's interesting part is this now. When you are taking the 1 grain of iron and you are going with the dilutions and succussions, my dear listeners, I tell you that the same iron is not there in the millionth potency, but the electron microscope could not able to read that. It has left it far behind, maybe attached to the bottle, which is not attached to the bottle, reached to the 3 millionth strength. You cannot dissolve the entire mass. Law of conservation of mass. You cannot. Only what are the things are required for that purpose, only that part of mass will be taken up. And the rest mass will be in inertia form. And that part, maybe you are taking a own gain, but in million potency, it is a some million electron microscope above something happen. If it happens, if it is distance is like the some star, some light year, hundreds, 2,000, 3,000 light year. So that mass, what it has taken is some, its weight is some light year to grain. Now you are getting from that our medicine. It is not that the whole thing come up to your 70-decimal potency, already left. It is the preponderance of one to another. For homeopathy, we do not know who is arranging this, but I know that it is the essence, it is the intelligence. Intelligentsia is arranging this. Intelligentsia is arranging this for homeopathy. Intelligentsia is arranging that for allopathy. Nothing has come out of itself. So when you are considering mind, health, body, I say you, madam, there is no two things in the whole universe. There is only one thing. You get out of that everything. It is this, when you are all thinking about mind, soul, body, I tell you, matter is everything. In this homeopathy immaterial world, I am telling, contrary, the matter is everything. And from matter, immaterial thing comes up. In the matter, this immaterial phenomena is in the occult form. When the time comes, this occult form of immaterial phenomena evolves itself from the matter. And what is required for him, he is doing that. You will see on your mythology, আপনারা দেখেছেন, ভগবান বিষ্ণু বিশাল সাগরের মধ্যে বাসুকির উপর ঘুমিয়ে আছে। So this is important. bogus. Instant. Are you listening me? Hello? See what is doing?
Yes, sir. There has been some technical glitch, I think, for your mobile call.
Hello.
Yes, sir. Please
Are you
continue.
listening? Yeah. That is the very important part, Dr. Bidyut. And that will explain you potentization. You won't get in the Western philosophy. It is in our philosophy, Indian philosophy, you get that. If you place homeopathy to certain place, that homeopathy is the Upanishad of medicine. Neti, neti, neti. All know, nothing. Nothingness is our business. As in Upanishad, nothingness is their business. In homeopathy, nothingness is our business. So, we have a discussion now. You have understood that all mass is not converted into, evolved into your energy. Only the required part is also only work. The rest part will be again in the inertia stage. When you are taking iron also, the same thing happens. Only the evolving part is only for that whatever the mass is required, it takes, and neither it takes. If our mathematics supercomputer will come up, they will tell you where that mass left behind, either in third potency or in sixth potency or 12 potency, where the mass is left behind. And what mass is remaining in the millionth potency. Only a supercomputer could explain thing in the longer period. So I'm mostly talking about cancer and the drug designing factors. So our drug has been designed to do that work, because one great philosopher has written very interesting thing, W.E. Boyd, a deviation from fundamental mean within its variable limit, reversible limit, can be restored to normal by way of stimulation applied in the form of drug or anything else in subphysiological dose. So reversible limit, this is important. This is not unconditional. Even in homeopathy, that is a conditional. That conditional is within the reversible limit. Your drug is designed, your drug is so designed, so it only works within the reversible limit. And it doesn't work in the non-reversible unit. That's why you get, even in homeopathy, so many failures written in your book, seen in your practice. Now, if you want to now make it a new design drug, which works not in the reversible limit, but beyond that, you have to design something new. Once a student came from CCRH, had told me, Doctor Sir, we have come here to learn cancer about. We told them we have not yet finished. How can I say the drugs to you? Then how can we learn? I say, Sono, তোমাকে একটা ছোট কথা বুঝিয়ে দিই. Have you prescribed Maxol? Yes, sir. And have you prescribed Maxanet? Yes, sir. This Maxanet has a carcinogenic trait. This Maxol doesn't have. Now you develop it. So in arsenic, we are prescribing. Now if you arsenic is mixed with the cyanide, if you arsenic mixed with like all these carcinogenic substances, or if we take the help of recombinant DNA, that I do not know why I used to speak these things since my coming to homeopathy. I used to say always, unless otherwise you are able to produce recombinant drugs you are not able to deal with those diseases. Now the allopathy has come forward. Now they have gone up. They are now producing the recombinant. Even in the corona vaccine also, they are producing the recombinant. So this is also required simultaneously for homeopathy too. So your drug design, drug discoveries, keeping in mind with such diseases, cancer, HIV/AIDS, diabetes, like such diseases. Because such diseases have come up now. When I was a child, I did not listen cancer. Then people used to say when I was a student, "Hey Baba, এই ক্যান্সার আমেরিকাতে হয়, এই ইন্ডিয়াতে হয় না, এই গরিব লোকের রোগ নয়, বড় লোকের রোগ." I do not know the India now become rich or not, but I am sure now previously it was in a village, it was in an area low, then it comes into a village, then it comes in a lane, gully, then it is in every house. Now cancer is in every house. Now we are blaming our lifestyle. Oh, you're taking cigarette. Hey man, you are not regulating your life. The cigarette is harmful to cancer. But a lot of people are taking cigarette, not affected with cancer. They affected mostly, we see the bronchitis, asthma. They are saying, oh, sir, we are, sir, due to cigarette, sir, I have asthma. They are not saying, sir, due to cigarette, I have cancer. This is a paper talk. This is a paper talk. So how cancer affects? What is there in cancer? So that is important. And
Dr. Mishra, please. So we have time constraint.
sir. So now how many minutes are for me?
Hello, Dr. Sharma sir, I think 1 hour is over. Hello, 1 hour allotted to is over. And I think the organizer should give you another session for you to discuss.
This is very
You have a lot of things
complicated chapter.
philosophy.
Dr. Kalyani has told me you have a World Cup today, so people will be very
Not only that,
interested to
you
enjoying
need
that.
another session because you have a lot of things about philosophy to say. You have many more things to say, cannot be compressed in one session.
That's true. That's true. That's true. We are going with some new drug discoveries.
So I request you to conclude your talk, or if it is concluded, we will. I have got few things to say about this. About my.
Yes. You are please say something. Put line on my discussion.
Sir, there are two things. One is the state of the illness and the state of the patient.
Right.
Whether it is cancer or any other disease for that matter, these two are not proportional.
Yes.
And most of these patients with cancer are coming to us when they are old. That is probably because the cancerous process takes time to develop into cancer. Now, the state of the patient determines a lot about the state of the illness. When I say state of the patient, it means what is their attitude to their illness, how much they are suffering from the illness, and their social environment, how much they are loved and respected, how much they are taken care of, what is their own psychological state of mind. For example, Ramakrishna Paramahamsa and this Ramana Maharishi, these two great saints, they had cancer. But their state of their mind was so good they did not suffer much from the illness, though their state of the cancer was very severe. Similarly, the prognosis of cancer patient is very much dependent on their state of their mind, state of their attitude to the illness, their response to the illness. And we can do a lot to provide a lot of positive inputs in their mind so that their attitude to the illness improves. And also, in our organelle of medicine, they say that in acute illness, give the patient whatever he wants. Let him lead his life as he wants to lead. I have one example, one anecdote to say. My father-in-law's brother, who was in 75, he was a non-diabetic for 30 years. And suddenly he was getting severe abdominal pains, losing appetite. So he was taken to the hospital, found to be having extensive development of extensive colorectal carcinoma. And my brother-in-law decided that it is not worth telling the state of the illness to the patient. So the fact that he was suffering from illness was not told to him. And there the doctors have given him 3 months of life. Lifespan was 3 months. But he lived for 4 years without any suffering, and he died peacefully at the end of 4 years. So, similarly, I have another person who was a bank manager, and she had adenocarcinoma of the breast. And she was a deeply religious person. She was a Christian. She followed her faith or whatever it is. And without any medicine, without any chemotherapy, without any conventional anti-cancer treatment, she lives even today, even after 20, 25 years. And she named her house as Faith. Her story has come in India Today magazine, cover magazine. So, similarly, there are few more cases, and this Chopra, who is a famous medical writer in America, Deepak Chopra. He has also discussed thoroughly about few miraculous cures, and he says that what one person could achieve can be duplicated, if not to the same extent, in smaller extent in every patient. So we should also focus our attention on improving their social environment, improving their psychological environment, and improving their response to the illness. So we can do a lot in helping the cancer patients through this method. So this is what I want to say. Thank you.
Thank you.
Hello.
So, what I mean to say that I'm telling for 1 minute that oneness of the fact. I'm not talking about the universe. What I see, the only one. Only one. Energy, life, mind, everything is in the matter.
Yes.
Everything is in the matter. One. When the Big Bang, there was a Big Bang, there was a throwing of all particles. That particles took that energy. And that energy is with it till now. That is oneness that I'm telling. And we should not be happy with this. Something magical, something is, we are not happy. We are doctors, no?
Yeah,
we
definitely.
want to see, we are doctors. We want to see every man is getting cured. We are, see, a boy is idiot. Too much of education, better environment and others. Can he be grown up like Einstein? That intelligence is important. So
But
we talk about that, the matter which contains the intelligence also, as well as the inertia, as well as the force. So it is there. It is oneness. I'm talking about the oneness. That's why I'm speaking about the universe, because I say that by oneness you can mathematically explain the whole universe.
yes. Okay, sir.
Thank you, sir.
So,
Thank you, sir.
So we will release our viewers for.
Thank you so much, sir.
Yes.
Question.
I finished my talk.
Yeah. Hello.
Hello.
There is some network problem, I think, with Bidyut.
Yes.
So I think
Anyway,
we can conclude this and release our
but it's a great
viewers for.
day. Let us conclude today's program. So
Yes.
everybody is waiting to enjoy the game.
Yeah.
Many thanks. We are really very, very grateful and thankful
Thank you
to
all.
our respected Dr. B.N. Prakash for coming with us and encouraging us and giving his experiences. Yes, really all of us are paying many, many thanks, and we are very happy. Our beloved daughter, beloved sister has come forward, Kaveri Pandey, as a inaugurator. We pay thanks from all of us. Regarding TK Mishra, he was my colleague. I know very well, more than any of you. He is definitely a striving personality. Regarding cancer, it is a great disease, and continuously it is disturbing the whole humanity. We will talk next session, conversations, and our honest to all the viewers and listeners. seniors and juniors to come forward with little bit of experience of cancer by which we can have a good record of this theory dealt with cancer for a lengthy period. So please come forward. Give us info about your telephone number, name. Those who are having little bit experience on cancer will continue this program in near future.
Thank
Thanks to all of you. Let us end today.
So there
Thank you
is
very
one
much.
question. So there is one
Please,
question for Dr.
Yes.
Mishra.
Yes.
please.
Out of 1204 cases treated in NIH cancer research, how many got better life situation and how many became worse and how many were the control?
Yes. I have I'm answering to that question. I used to keep telephone number of the patients. So when I am telephoning for you, this cancer project also, and earlier also, I through telephone number, I tried to connect them. The answer was, he's dead. He's dead. Certain cases,
Okay.
I have explained to you that under medication, they survived 5 years. 5 years. Some of the cases survived 5 years. But after that, they succumb to death. And you are talking about quality of life, Dr. Bidyut. Hello?
Yes, sir. Yes, sir. This is a question from Dr.
Quality of
Chandrasekhar Pore.
life. Quality of life. Quality of life is WHO quality of life. That term has brought by WHO. And particularly for the CAM medicines, complementary and alternative medicines. Because here, non-specific actions of a drug is showing the specific action. It is showing the specific action. So lycopodium is an inert substance. It has no medicinal value. But when it is being potentized, the greatest medicinal value. So the non-specific action of a drug, it becomes specific. So it is difficult for WHO to target a drug designed with the idea of scientific idea. So WHO has told, when you are not able to bring these positive points from the evidence-based cure, then you try to assess it from the quality point of view. That is a quality of life. Moreover, one practitioner in homeopathy, it differs from another practitioner. There is no targeted thing. For tuberculosis, everyone will prescribe streptomycin or rifampicin or isonex like that. For a tuberculosis, Dr. Mishra is prescribing tuberculinum. Dr. Kalyani is prescribing phosphorus. Dr. Pandey is prescribing, say, sulfur. That's what WHO told. They're not from one prescribers. We must to set up a number of prescribers. And from number of prescribers, when this non-specific action of a drug is showing the specific on certain disease, we will take that. The point is, how we will take that? We cannot test it in the laboratory. How we will take it? So WHO has told, you take the quality of life. How he lives, how he sleeps, how he eats, what is his health, what is his sex, what is his recreations, what is his transport. You take everything like that. From that point of view, you understand the man, this human being, is living like a human being. So from that point of view, the shadow and the light, from that point of view, understand this man is improving. Another very important thing is doctors, Dr. Bidyut. If you do the marker, if you use a marker, in homeopathy method, research methodology will fall down. Because we are seeing in our practice, Dr. Kalyani also has seen in his practice, patient is improving, the marker is not changed. Such same thing happened in NIH. Many people, many my patients' guardian told, doctor, what medicine you are giving? His same TSH level is 39, not even 38. He is getting your treatment for last 5 years. Then I said, what is his quality of life? Ask him, ask her, husband and wife started fighting with me, husband. Then wife told, hey, no, stop it. Now, doctor, I have good sleep, a good food, my menstruation all right, my skin patches and everything disappear, I'm all right. Same thing happened to one doctor, Dr. Kumar, few days before me told me, sir, I have prescribed remedy and wonderfully acted on the young female, the acne and very bad acne. I saw that their IgE level is very high. But even after that, after totally cured, that if that IgE not falling down, sir, you please explain me. You never try to treat your patient on the basis of marker. Our medicine is not prepared, not pharmaceutically, not it has been designed to affect the marker. If it is a marker, if it is related to your disease, it will fall down one day. Don't forget, it will forget one day. You don't bother for that. You don't bother for that. I've got many patients diabetes. Sir, you are treating my blood sugar is not getting down. Bother, don't bother blood sugar, blood sugar. How you are tell me? No, sir, I'm well, sir. I'm doing every work. My brother is taking insulin, sir, bedridden, sir. Lot of remedies, lot of bedridden, sir. I'm all right. That's important. That's important. Our things are, our drugs are not designed to touch that. And that thing also will go when it will reach to certain extent. And you know the diabetes is a maintainable disease. It is not curable disease. So you cannot get cured. I'm not giving you guarantee. I cannot never be able to cure you of blood sugar level. But I can give you guarantee that you will live long, your quality of life will be improved, you will be not destroyed. The comparative to allopathic medications. So I have seen a lot of cases. So Dr. Bidyut, this is also the great point I'm telling you. You are raising this point. I'm telling you that you shall not in your practice look for marker. You prescribe and you see how the patient is responding and you see the patient is well. So that is one point is in a research methodology. When you're telling a research methodology, that Western methodology which stands on the marker. In homeopathy methodology, it doesn't stand on the marker. That's why WHO has the right to say the quality of the life you Jesus, not the marker. Quality of life. That is important. Thank you. Any more question?
Another question for Dr. Prakash and Dr. Mishra, sir. It's on the screen.
Yes, yes.
It's from Dr. Arghut Chatterjee. If we can't give results in reports, then how can we say that we are evidence-based medicine?
Please repeat it again.
Hello.
Uh,
Hello.
uh, if we can't give results in reports, then how can we say that we are evidence-based medicine?
That evidence-based medicine also fall under the criteria of your quality of life, Dr. Bidyut. It is also applicable in cancer. It is also applicable higher. It is approved and recommended by WHO. Not everywhere you will say that a marker is only evidence-based proof. No, I don't agree. WHO does not agree. Who is Dr. Mishra? WHO is not agree. WHO told that you listen to that point. Non-specific drugs are working on and yielding result. Non-specific drugs. I mean, scientifically they are thrown away, non-specific, but they are still working on. So WHO has assessed their quality of life. Indirectly, we'll understand they are in a good position or bad. So evidence-based research also, quality of life is important. You cannot discard quality of life. You cannot.
Right,
You
sir.
see the
Thank you so
young.
much.
Thank you.
Okay.
Thank you so much. And a great session tonight, indeed, in spite of Messi playing for his last World Cup and already scored 2 goals,
Right.
Argentina. Still, there are 54 live viewers on the studio.
Oh
As I
my
can
God.
see from the laptop, it's a 54 live viewers. So the essence of CME, the uh, people are really interested for education, and it's a great thing that we are connecting our next generation. Kaveri, congratulations to you that you had come forward. We need your
Thank you, sir.
batches, 21st, 22nd, and all to be there in the upcoming CMEs as a speaker. There is another question. It popped up from Probir Mujumdar. What are the roles of Arthur Hill Grima cancer equipment experiment for cancer treatment? Question two, sir. Said arsenic fail in cancer, in cancer ulcer, but
Yeah.
in boric materia medica and Allen's keynotes, we found eupatorium. Yeah.
Sir, as a old school
Euphorbium.
practitioner, hello.
Hello.
Sir, as a old school practitioner, I don't believe in talking about any specific medicine because
Right.
I still believe that every patient has to be treated as an
Right.
individual. The acute
Right.
totality is
You're right.
different from person to person. The constitutional totality, the anti-miasmatic totality, they are the best treatment for any type of problem, including cancer. So I don't believe in arsenicum working in one patient or eupatorium or any drug, any acute totality, based on any acute totality, any medicine that is indicated will work. That is the best medicine.
You are true, Dr. Prakash. The
Yeah,
point is that
yeah.
it is not working. It is working on ulcer cases, but it is not working any cancer case. That is the point. That is the
Sir,
point.
that
That I'm not talking about homeopathy. I'm talking about only this subject. It is working on all cancer cases. It may not work. Phosphorus may work. Also other medicine may work. But we
okay.
see that it is working on some cancer cases. But it is not able to cure cancer case, single cancer case. So there
Which
is
one?
something, some drug designing. I'm talking about the drug designing. We have to change. We have to evolve the drug designing.
Okay.
When you are going to treat the incurable cases like cancer, we have to evolve the drug designing. That I'm going to say.
Okay. Yeah. Okay. The drug designing has to be modified.
Thank you. Thank you.
Thank you, sir. And as you all seniors, our margdarshaks for the future generation, and we in the Alumni Association for CME being headed by Kalyani, sir, the great scholar and the research worker. So we are in the process of learning and we'll learn, unlearn, and also we'll learn further. With this hope, today the people 55 as of now live. Uh, I request our president, sir, and the CME committee to get part two of this session with further details. There are a lot of questions, brainstorming sessions, and request Prakash and Kalyani sir and Mishra sir to have a phone call together and
There is a network issue, I think.
Yeah.
Anyway, what I think that his point of discussion was we will arrange another CME on this cancer with some other new speakers and old speakers. You are requested to
Yeah.
be there.
Yeah.
Let us arrange the time, we will announce. So anyway, without wasting time, let us complete the session. Bidyut
Yes.
might be some network problem. Okay, thank you very much.
Okay.
Thanks to all. Good night.
Thank you, sir. Thank you. Let's
Thank
conclude
you.
Let
this.
us
Thank
go to
you, Dr. Kavi. Thank you.
thank you, sir. Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And it's a tough call that we are being finishing so fast as it's FIFA World Cup's final. And let me give you the update. It's being 2-0 for now. Argentina is on lead. And so best of luck to all the Argentine fans and sad for the France fans. So good night to you all. Enjoy today's means FIFA final. And it's me, Orko Mukherjee, leaving. Good night all.